Hello, everybody. Hope you all people are doing fine. I can just hope that because, as you all have heard, what's going on with doctors in this country. I mean, it's pathetic that some of the best brains of our country and they have to just sit on the road for what? किस लिए बैठे हैं? Just for counselling. I mean, the whole world is preparing for Omicron, Corona third wave, and lo and behold, in our country, doctors are sitting on the road so that they can join the workforce. I mean, if it's the responsibility of government or if it's the responsibility of doctors to have proper workforce. I mean, I seriously don't know what's happening with this country. Are we becoming banana republic? The whole world is preparing, and here we are doing PR baji and event baji. The Prime Minister has no sense that whether he has to prepare the country for third wave. In second wave, lakhs and lakhs of people died, and then there was no media outcry, nothing. Everything was managed. You know, nowadays everything is managed in this country. Everything from media to elections to everything is managed. मतलब जब मन किया फूल बरसाया, जब मन किया लाठी बरसा दी. 1 साल से ज़्यादा डिले हो चुका है. आखिर ये चाहते क्या है? प्रोटेस्ट 1 महीने से चल रहा है, लेकिन कहीं कवर नहीं होता ये. Nowhere it's getting covered. I mean, it's the duty of each one of us, each and every one of us, whether we are in PG, whether we are doing MBBS, whether we are preparing for MBBS, whether we have done SRship. And why only doctors? It's the duty of every citizen of this country. I mean, government hospitals are not for some ultra rich people. They have their arrangements in the branded hospitals, and everyone knows that. These politicians, bureaucrats and businessmen, they have their arrangement. Who suffers is a common man who goes into these government hospitals, and eventually they will only suffer, while the leader will wave their hands and be on the TV whole day. So this is what is happening. I mean, no media will cover this. कैमरे के पीछे ले जाके पीटते हैं और कैमरे के आगे संत बन के घूमते हैं ये लोग. ये बहुत बुरा है. And I would just like to tell everyone that, especially young doctors, that please either you don't choose this field, or if you choose, then somehow you please go to some other countries like US or UK. India doesn't deserve doctors. That's a very blunt truth, but that's what it has come down to. I mean, on one hand you give rights to Ayush doctors that they can do surgeries, they can do whatever they want without giving any exit exam or proper regulation of their colleges and all. And on the other hand, some of the brightest minds who have prepared for MBBS and who have got admission into this, they have to give exit exam, then they have to face lathis, then they have to do bonds. And when they demand their basic human rights, you just don't listen to them. I mean, what comes next? Everyone knows what is coming next. It's very disheartening, guys, and please do whatever you can do. Please do support this cause. You can use Twitter, and on Twitter there is a hashtag Doctors Strike which is going on, which is trending now. So please do tweet a lot with that hashtag. Do share these videos in your family WhatsApp group or anywhere and everywhere you can share. It doesn't need to be a medical alone. You can share it with anyone and just tell about what's going on in this country and what's happening, because ordinary people, they don't know what's happening because there is no coverage at all. If you go and talk to some layman, they will not understand your issue. And it would not be a hyperbole if I say that all the doctors would be declared international soon. So that can happen. I mean, anything is possible nowadays. So before it happens, it's our duty that we educate the common citizen of this country that what's going on, and we should explain our cause, why we are protesting, what's the issue, and eventually who will be benefited from this. I mean, we are definitely going to join our course, and our course must begin. But first and foremost, the patients will be benefited from this. I mean, the OTs are being cancelled, emergencies are being hampered. Who is suffering? It's of course poor patients who have come from far away distances, and they come with lots of hope, and then they eventually don't find doctors. The haves and have-nots. The haves have their branded hospitals. They will manage. It's none of their problem. But it's the problem of each and every tax-paying citizen of this country. And please do share this video, do like this video, and just say around all these things which are happening. I mean, this is the need of the hour. Please do it. Thank you.